welcome everybody to our Zoom meeting. We're it's a rem I'll remind everybody that one of the league's main purposes is to educate voters about issues. Uh, Being nonpartisan means that we do not support particular candidates or parties, but rather focus on the elements of issues that voters will consider during elections. Today, our topic is how Medicaid and ACA cuts will harm North Carolina. Our presenter is Fred I. Lewis, and I emphasize the I because there are other Fred Lewises that been on some of the TV shows and everything, so I don't want to mix them up. Fred is an attorney and public interest advocate. He graduated from the University of Texas Law School with high honors in 1986. Seems like yesterday. After serving as a briefing attorney for the Texas Supreme Court, he practiced private and public education for some years, and in the process served as the head of the Texas Attorney General's Insurance Practices Section. He's a native Texan and lived in Austin from 1976 to 2023. Like many of us, he then moved to Winston-Salem to be closer to his three grown children. We're gratified to have this many people sign up, and we definitely want to be here for people. But I'd like to give Fred time to give his short presentation, and then he'll take questions. And just to remind everybody again, as Barbara said, we prefer that you use your electronic hands up if you can. Otherwise, you could put something in the chat. But when you get recognized with your question, we'll need you to unmute yourself and then ask your question. So with that, I'm going to go ahead and turn it over to Fred to tell us a little bit more. Oh, and just that kind of parenthetically, this is going to be talking about ACA cuts, and of course, that's really in the news with the pending compromise extension of the tax act. But we definitely were going to want to talk about Medicaid because that will relatively quickly be on our political landscape. So, but Fred, I'll let you go ahead then.
Thank you very much for having me. Um, as Wayne said, I have a background in health insurance on and off for many years. But when I was a young lawyer, I was involved with both fraudulent in bringing cases by the state against fraudulent and deceptive health insurance and other insurance companies. And that has affected some of my opinions about the viability of the marketplace when most consumers don't understand health insurance. So, to be candid with you, I'm not a big fan of deregulated health insurance. I've seen it up close. I think it's not the way to go, but we'll talk about that later. I also want you to know that one of the other things I worked on for years in Texas was campaign finance, ethics, and independent redistricting. And I worked with the League of Women Voters of Texas and of Austin for years on those issues. So I admire your organization greatly. And with that, I am going to go through an overview first of the Affordable Care Act to make sure we're all on the same page. I want to say the sources for my information are what I consider the best overall source, which is the Kaiser Family Foundation, KFF.org. Uh, a lot of this is nuanced. A lot of it is difficult and complex, and some people have access to crime. Some people are ill-informed. So I tend to rely on the KFF because they are nonpartisan, objective, and well-informed. So the first thing I want to say about the ACA is it was passed in 2010. It was implemented fully in 2014. So we've had 11 years of the ACA. And basically, the ACA was trying to build on the current system we had and to fill in the gaps. So we had Medicare for people like myself, for older people, 65 and older. We had Medicaid for the very poor, and we had employer insurance. And of course, we had individual or non-employer policies. And that left a number of people without coverage. And in fact, we had about 45 million people in the United States without coverage. About 18% of uh, of those under 65. And that is an outlier for developed countries, wealthy countries such as ourselves. And so the ACA was trying to fill gaps so that we would increase the number of people that had health coverage, plus obtain some cost savings and some other things. The way the ACA tried to do this is two ways, two big ways. One was to expand Medicaid, our program, our government program for low-income people, and by offering generous matching funds to the states, up to 90% of the funding, to get to raise the eligibility for Medicaid up to 138% of the federal poverty level. The Congress and the president had passed that it was mandatory that states participate in the Medicaid expansion. Supreme Court decided that was unconstitutional. And so it has to be voluntary. We now have 40 of the states in the District of Columbia that have signed on to the Medicaid expansion, including 2 years ago, as y'all know, North Carolina. Um, and that has made a huge difference in the United States. We now have about 21 million people on the Medicaid expansion. And that's about 77 million people in the United States are on Medicaid and CHIP. It is the largest insurance program in the United States. And for non-seniors, it covers about a quarter of the public. In North Carolina, 3.1 million people are now on the Medicaid, about a quarter of the public, and 685,000 were added in the last 2 years with the state adopting Medicaid expansion, which is a really impressive number when you think it's only been 2 years since the ACA expansion was passed and implemented. So the second part, so that was for mainly people that were basically very close to the federal poverty level, basically very low income people. And that's what the Medicaid expansion was about. The other part was the Affordable Care Act exchanges. And what this was for was people who did not have employer insurance subsidized by their employer, and had too much income to afford Medicaid. And so this was mainly small employers, uh, self-employed, people that worked for small employers, because the employer system uh, only provides coverage uh, for about 50% of their employees. The rest of them are without coverage from employer insurance. So what happened with the ACA and how we got here is the federal government prescribed standardized policies with standardized benefits and other rules and offered them on either federal or state exchanges, of which you could purchase a private insurance policy with various parameters. And they also provided subsidies so Americans could afford it. Um, when they passed the Affordable Care Act in 2010, the subsidies were always too small to really address the problem of people not being able to afford private insurance, who weren't having their employer provide most of it. So we had until about 2021 about 11 million people in the Affordable Care Act, about 500,000 in North Carolina. With the Inflation Adjustment Act and the pandemic, the Biden administration passed what was called enhanced premium tax credits that were much more generous. They also provided an opportunity for people between Medicaid and 400% of the poverty level, and also for people who were cost burdened by health insurance above 400% of the poverty level. And this was mainly designed for people just above the poverty level up to the middle class. And with these enhanced premium tax credits, the number of people who signed up went from 11 million to 24 million. And in North Carolina, we now have about a million people on the Affordable Care Act, around a little less than 10% of non-senior adults. And that is what we've gotten from the Affordable Care Act up until 2025. And so the benefits of the Affordable Care Act is we went from about 18% of the people uninsured in the United States to 9.5%. And of those uninsured in Medicaid expansion states, the 40 states that did Medicaid expansion, it averages now about 7.6%. So there's been a huge decrease in the number of people without coverage. The second thing, although there's a lot of disinformation about this, health insurance premiums have gone up under the Affordable Care Act, but at a smaller rate than before. Before, the average annual health coverage cost increase was about 7%. It's now, or was until recently, about 4.5%. And so the Affordable Care Act increased the number of people that were insured, decreased healthcare costs, and that had a benefit to people's life expectancy, their wellness, and their productivity. And the research is pretty clear now, it wasn't in the beginning, that having health coverage benefits your life expectancy, benefits your wellness, your healthiness, and your productivity. The evidence is pretty overwhelming now. And also the Affordable Care Act provided people with more financial security because a lot of people have had massive medical debt they could not pay. So that has been what the Affordable Care Act has provided. It is not a perfect system. No one says it is, but it has produced most of what we ask it to do, which is provide greater access and try to bend the healthcare cost curve. So, what has happened in
Oh.
2025? In 2025, both Medicaid and the ACA took serious cuts. Um, Medicaid expansion, which is what the cuts were directed at in the one big beautiful bill, there were a $911 billion in cuts to the Medicaid expansion over 10 years. That is about 23 billion over 10 years to North Carolina. So you're talking 2.3, 2.4 billion dollars more or less that the state is going to have to pick up in North Carolina. You also have to add to it the $435 million approximately in SNAP cuts that have been pushed down to the states. And so the point is, we already are struggling to refund our state budget, public education, housing, other things. And the legislature is going to have to figure out whether we are going to have $3 billion in additional cuts to SNAP and Medicaid, or are they going to figure out a way how to pay for it? And usually that involves taxes, whether people want to acknowledge that or not. Of course, the issue is who pays the taxes. Um, but basically, Medicaid is going to these massive cuts to Medicaid are going to happen mainly starting in 2027 after the election. And that was designed so people would not feel the pain until it was too late. The other thing is Medicaid, the way in which it's done is that really they didn't really change the eligibility for Medicaid. It's still 138% of the poverty level for the expansion. What Congress did is they imposed a lot of paperwork requirements, a lot of burdensome processes, because they know that a number of people will drop out because they're either not sophisticated in dealing with the government, don't understand the Medicaid program, are ill, or too burdened by poverty to pay a lot of attention. And so we're not really cutting the program directly. We do have a work requirement I could go into later, which doesn't really affect many people because most people either work or already exempt. But we have created a system that will be very difficult for people to navigate. And that's how they expect about 11 million people will drop off Medicaid. It won't be they'll still be eligible. They just won't be able to comply with the paperwork. And frankly, we know this. There have been years of increased paperwork and burdens. There have been pilot projects. They know about 25% of the people, maybe 33% of the people on Medicaid are going to drop out simply because of paperwork hassles and burdens, which I personally don't find a very straightforward way to deal with American citizens. It's almost like we're going to emulate the worst practices of health insurance companies, which I don't find a way to deal with the issue. So that's Medicaid, and there are about 250,000 people in North Carolina who will drop off the Medicaid expansion. Let me say this, we really don't know how many people are going to drop off. What I gave you was an estimate of 11 million nationally. The reason we don't know is how many people are going to drop out when you make it hard for them to comply with the paperwork requirements. And we've added layers and layers of complexity and interactions of various rules and statutes. So we really don't know. But the estimate is about 11 million people who are poor are going to drop off over a period of time from Medicaid. So that gets us to the Affordable Care Act. And the reason I like to emphasize the Affordable Care Act is because it's happening as we speak. The Affordable Care Act, the enhanced premium tax credits were supposed to expire the end of 2025. Why? Well, you could say it's because the pandemic was ending, but the truth was they expired in the end of 2025 because that's all the political support they could get to pass it for 3 to 4 actual years. And so they did what they could and passed it as long as they could.
No, no,
So in
you had yours. Mm-hmm.
can you mute yourself, sir? It's hard to talk over you. Okay, I'll just keep talking. Um, so the Affordable Care Act premiums are going to expire at the end of this year. It's pretty clear from what happened today with the Senate going ahead and passing a continuing resolution and the other things. and allowing a vote in December on the ACA, that the ACA tax premium tax credit enhancements will expire in the end of this year. I mean, anything's possible, but frankly, it was pretty clear when the Congress didn't extend the premium tax credit in the one big beautiful bill that they were not going to extend the tax credits. And the reason I say that is when you pass a $4.2 trillion tax cut and you don't extend and you extended tax cuts for all these other business and individual provisions, the normal thing to do would be to extend the ACA tax credit enhancement if that's what you wanted to do. And they refused to do that. And therefore, it became always very problematic that the premium tax credits were going to be extended. Let me say what the premium tax credits cost. Because there's been a lot of misinformation. The premium tax credit enhancement cost about $350 billion over 10 years, $35 billion a year. Our budget is $7 trillion. So it's not a money problem, it's a priority problem because we could find $35 billion a year for the ACA if we had the political will to do that. I want to explain because a lot of people think, well, why do we have subsidies for private health insurance? And I'll tell you, there's a real simple reason. People who do not get employer health insurance or government health insurance, the vast majority of them cannot pay for private health insurance. And why do I say that? Today, the median family income, more or less, of a family in North Carolina is about $70,000 a year. The average household full health insurance policy, individual policy in North Carolina, and not subsidized by anybody, is $25,000 a year. So there is no way the average public person who is not affluent in North Carolina can pay 38% of their income for health insurance. So when people talk about they don't want to pay the money to subsidize people and that somehow or other the subsidizing of private insurance is wrong, what they're saying is those people should not have health insurance. Okay? Because you either have two systems if you want to provide health insurance for people that get it under the ACA, which is middle class, working class people. You either have the government provide it or you subsidize private insurance. There is no other answer that's realistic and comprehensive. So what is happening with the ACA? The first thing is with the premium tax credits going away, the enhanced credit, on average, and that's an average, the premiums are going up just because of the tax credit going away of 114%. It's more in North Carolina, I know, but I have not seen it broken out how much more it is on average. For low income people and also for older people, it's going to be much higher than 114% because the premium tax credit picks up more for those folks. It'll be 200, 300, 400, 500% more, depending on their circumstances. But the 114% on average nationally doesn't include the premium increases by the health insurance companies themselves. And there's been a lot of misinformation. I read the media and they don't seem to understand that there's two parts of this increasing. One is the premium tax credit expiring, and the other is the insurance companies raising the premium rates for ACA policies the most they've raised in 10 years. And let me be clear, that is caused by a couple of factors. They really don't have anything to do with the ACA. They have to do with policies, frankly, of the Trump administration. First, when you increase premiums as much as they've been, the premium, when you have an increase from premium tax credits expiring of 114%, people that are consider themselves healthy or just can't afford it drop out. That means the risk pool is much sicker for the ACA. And that is driving a huge portion of the 26% increase from health insurance companies because they think there's going to be a really sick health insurance pool and there's a lot of uncertainty. The second thing is tariffs are having an effect. Healthcare supplies have tariffs on them. So that's having an effect. And then there's also the effect from just general economic uncertainty and worries. So health insurance inflation, which has been about, it varies 5 to 7% a year. That isn't what's driving this. What's driving the health insurance companies' premiums in the ACA are all of the uncertainty caused by the ACA premiums not being expired, economic uncertainty, tariff uncertainty, and things like that. Um, I will say this: I could go through the various arguments against the Affordable Care Act subsidies. One, it's unaffordable, which is not true. Two, it goes to undocumented workers, also not true. That we're throwing away money on private insurance system. Well, we either throw away money, throw away. We either subsidize private insurance or we're going to have a government insurance system, or we're going to go back to having tens of millions of more Americans not insured. Uh, the other argument about fraud and waste in the ACA, there is some fraud and waste. It's pretty minimal. The fraud is mostly by brokers. It's not by patients. So there are things you can do to clamp down on broker fraud. I promise you, I know how to do that. I dealt with scoundrels in the health insurance industry, but that requires money and willpower to do that. Um, so what's going to happen with the ACA is even if they were to pass the premium tax credits, they're going to do it so late this year that most people have already gone to the exchanges and found out they can't afford their premiums. Whether they ever come back, I don't know. But it's going to cause complete turmoil in the ACA marketplace. Um, and so we're going to have a discussion going forward about what happens with the ACA and in 2026 we'll have a discussion, 2027 I'm sure, 2028. But frankly, there is no reasonable alternative from the right other than the Affordable Care Act. Basically, in my view, they're just saying we want to save money. And so we're going to cut these programs. And the fallout of 500 or so thousand people in North Carolina no longer having insurance, and about 16 million with the ACA Medicaid cuts. That's just tough. And with that, I'll stop and answer any questions. But the point I'm trying to make is the Affordable Care Act has worked. It has problems. A wiser approach, in my view, would be to build on it and reform it to make it better, not just cut it and hope for the best, which will actually end up in the worst.
Okay, well, take questions. I will comment that I guess the thing that's kind of surprised me is hadn't realized how many people in the 55 to 65 age group, people with small businesses and such, were sharing or covering themselves through the ACA and are now finding themselves in a situation where they're going to be trying to do some kind of a stopgap, less expensive measure. And I think it's going to contribute to the phenomenon we've seen in the past, and that is the peak age for being diagnosed with cancer is age 65 due to the fact that people have put off concerns about signs and symptoms that and then got their diagnosis once they got Medicare coverage, which obviously has very bad effects on life expectancy. So do we see any hands up with questions or comments? Okay, remember
Actually, at this time, I don't see any hands, but
okay,
that doesn't mean that
Rob has his hand up. Rob Luciana. Go ahead and unmute yourself.
Okay, I'm Rob Luisana, and I have been a health insurance broker and ran a company called Pilot Benefits as the managing partner for about 15 years. And I agree with everything you say, Fred. I thought that was a great summary. The only issue I would have with you is that many of us want to push for expanding Medicare as opposed, what we found, and I do a lot of public speaking. I'm going to be in Myrtle Beach and then New Bern in the next month talking to civic groups. But most of us believe that we would be we would be better served having a Medicare for all system, rather than private insurance. We have 33 countries that they offer health care for their citizens, and none of them, all of them use a universal health care system, which essentially takes the profit motive out of the system. And whatever problems those countries have, they're minimal compared to the issues we have here. So, anyway, my specific question was, how would you remove the fraud on the broker end? Hit me.
Well, there are about, if I remember right, I may have this wrong, I believe there were 180,000 complaints about brokers
Wow.
last year. So, what you do when you do enforcement is you go look at those complaints and you start looking to see if there's a pattern from certain agencies and certain brokers or certain states. And then you start investigating people. And then, if you find that you have enough evidence, you sue them. And you start making it where people realize there's no free lunch in stealing or making misrepresentations about ACA policies to the public. It costs money, but if you are concerned about fraud, and I think it's important to damp down fraud, then you set up an enforcement process. And it's been done at the state level for years. The feds could work out something between the states. They could give the states money to do it, or they could do it themselves. But it's pretty clear how the fraud is occurring. Um, and so it just requires money and will. I did want to say one thing about the Medicare. Um, I think you're right in what you said. There are really two choices in my view. And this is what the other countries with universal health coverage, you either have a highly regulated public utility model, private insurance system providing universal health coverage, or you have a government system. But no one has a system like ours. But I am a pragmatic idealist, And one thing, for example, we could argue for, and people have, is should we extend Medicaid down to those that are 55 years old? And there are some good arguments to be made by that. But right now, I'm just arguing to save what we have from destruction.
We have a question in the chat from Amy Jerolman. How can Medicare be expanded when programs like Social Security aren't funded?
Oh, okay. Now, this is a failure of politics. Let's be real clear. Making, well, first of all, Medicare is in much better shape because there have been cost decreases than they thought. Social Security and Medicare, you need to take an approach where you decide you're either going to raise taxes significantly for the baby boomers and the increase in health care and Social Security retirement needs, or you make minor adjustments that reduce it without a whole lot of pain to people. But it is not a difficult problem actuarial. It's a difficult problem as public policy in a dysfunctional country. Um, this problem has been known about for 30 years. This was coming. And we put it off and we put it off and put it off. And that makes it much more difficult. So, to remind y'all, I think it was 1983, the Republicans and Democrats came up with a bargain and extended Social Security for 50 years. They joined hands, they made a compromise, and they jumped off the political cliff together. So it can be done. It has to be done. We cannot we cannot have a system where we do not provide Social Security and health care for older Americans. The only problem is, are we going to wait so long that it's going to be really difficult to fix? And that is a political problem. I don't consider it a policy problem.
Robin Judd, I think, has a question. You want to unmute yourself, Robin?
Sure. Hi, Fred. I was wondering if you
Hello.
had any statistics on how this will impact hospitals and emergency rooms.
Badly. Uh, okay, I'll give you some statistics. We know that rural hospitals and small hospitals have thin profit or operating margins. Okay. And that's for a lot of reasons, economies of scale. Also, they have more people that are uninsured. Uh, and so when you take away things that help rural America, like the ACA and Medicaid, because a lot of people in rural areas on both, then they are strained. And so they're going to cut services, they're going to close hospitals. That's going to have a bad effect on the economy of rural North Carolina. Let me give you an example. Not only is it more expensive to provide health care to people that are uninsured in the emergency room, um, but companies are not going to put plants and new operations in a rural area that does not have health care access. They are not going to be able to attract people if their employees have to go 40 miles to get maternity care. So it is going to have a profound effect on North Carolina because North Carolina is a very rural state. So over the last 20, 25 years, North Carolina has had the third largest amount per capita of hospital and clinic closures. So it's going to be a really negative impact on the economy and the health of rural North Carolinians. Now, how much exactly is hard because we're making these monumental changes to the system. And so, for example, when you raise somebody's premiums 140% with the credit going away and the premiums going up, how many people drop out? Nobody really knows. It's like saying if you increase the price of eggs 140%, how many people are going to stop eating eggs? Nobody really knows. But it's going to be devastating. And the benefits of Medicaid expansion from North Carolina, from passing the Medicaid expansion through 2 years ago, a lot of that is going away. So it is going to cause a lot of turmoil, pain, uncertainty. They're already providers are saying we're moving out because it's too uncertain what's going to happen to Medicaid. So no, it's not going to be good for anybody. There's a reason why developed, industrial, wealthy countries have universal health insurance. And part of it is the moral obligation, but part of it is promoting the economy and ensuring your workers are productive and that your families are healthy.
And with that, Judy Locus, Judy Lotus has asked a question in chat. How could universal health care work in the US? Would you have an answer to that? And I have a second one in the chat after that.
Well, look, there's political problems, okay? That's why we end up with the ACA, which was a directionally in universal health coverage. But basically, you do it the way everyone else does it. You either have a highly regulated private system where the government pushes down on costs and expands access, or you have a government program where the government pushes down on costs and expands access. But a system with holes like ours and arguing about it all the time and expanding it and retracting it, we honestly we need to get to a place in the United States where supporting universal health coverage of whatever system we adopt is not right, it's not left, it's not conservative or liberal. It's basically the system we have, and then we can argue on the margins. So if you look in Canada, for example, or other universal systems, there are disagreements on how much money to spend and all sorts of other things, but there is no dispute on having a universal system.
Right.
But getting there has been difficult and it will continue to be difficult. What I'm trying to say is destroying what we've created at the present moment is not going to be a step forward. It's going to be a huge step backward. And then see what I think is happening is these cuts are going to happen. We're going to have turmoil in the health insurance market. We're going to have a lot of uninsureds. Prices are going to skyrocket. And then the answer from people that never supported universal health coverage is, see, we need to get rid of it all. That would be a disaster with lots of people needlessly dying without coverage and being sick needlessly. And I'll be candid with you and say one other thing. The fact we don't have universal health coverage with our wealth is cruel and short-sighted and frankly dumb.
And I think that leads us right into Ellen's, who says if we did have universal coverage and people did not delay medical care, is there any estimate on how much we would save with a proactive approach?
There are a lot of different studies. They're all over the place. But we know that if you go to the emergency room, which is, the place of last resort, it's on average 12 times more expensive than going to a doctor covered. And we know people delay coverage. I mean, delay diagnosis, delay treatment, and all that is very expensive. Um, but I guess my faith is based on the fact where you have a government that is pushing down on the costs of providers and insurers and other in the marketplace and is heavily regulating this process. Their costs are much lower than ours. We have the most expensive system in the world, and yet we have gaps in coverage, both uninsured, and I didn't even talk about underinsured with people with high copays, et cetera. But our system is not one that anybody else wants to emulate. I mean, you will not find a country that says, my God, look at the great results they have in the United States. They're exceptional results, both on cost and access and results with mortality and morbidity. We want to adopt that system. No, the other countries are running away from our system.
Yep. Rob, you've had your hand up for a few minutes.
Yeah, Fred, I'm going to piggyback on what you said because I've got to share my experience talking with groups. I've talked to
Good.
about 50 groups in the last 3 years, and I am finding more of a willingness to consider a Medicare program. And especially when you start laying out the facts, and the facts are that the overhead for Medicare is 3 to 5%, and the overhead for private insurance is 15 to 20%. And then I will always have somebody in the crowd who will put their hand up and say, well, the government doesn't do anything as well as private business. And my response to that is to say many things that's correct, but healthcare, that's not the case. And then I ask how many people are on Medicare, put your hand up. How many of you are happy with your Medicare and 100% keep it up? And then I ask the same question about private insurance. And I say, well, take a look at the audience. We've got 100% acceptance of a Medicare system for those who use it, and we have about a zero acceptance for those that are in private insurance. Um, again, if we can make the system efficient and remove the drains we have, which are the insurance company profit, the advertising, the prescription drug, if those things could be pulled out, I think people would be comfortable with the system that covers everybody and they're familiar with, because people are familiar with Medicare, they know it works. Now, I've differed from many of the people, or some of the people at least, in our healthcare roundtable, because I have a hard time accepting the J. Paul bill, which I think is so over the top that it's never, ever going to get accepted. And so my dealings with regular, normal people is Medicare makes sense. They would accept a Medicare system like we have now, pull out the profit motive. But if you start putting in something that says no cost controls, uh, et cetera, it's not going to fly. So
No.
anyway, I've talked too much. I'll
Well,
stop.
I think you're onto something. I guess the only thing I'm saying is let's see what happens after people find out, 22 million people find out their premiums went off the roof.
Yeah.
And then let's see what happens when people on Medicaid find out that they haven't been able to comply, even though they're poor. And let's see where the public is after those elections uh, about adopting a different or reform the system. Um, and because uh, I think well, let me put it this way. The evidence is the best polling data I've seen is about 75 to 79% of the public supports extending the ACA premium tax credits. That's across the board. Um, even about 50% or even a little more of hardcore right-wing Republicans favor it because people know they need health coverage. Okay? Even Marjorie Taylor Greene gets it. You can't get rid of the system without replacing it with something because people want, need, and our society needs health coverage for everyone. I did want to say one thing about the shutdown, and if you will indulge me, because I have a little bit of a different view than most of the talking heads. My heart is furious at the Democratic senators for going along with the compromise. But my head tells me they were checkmated. And you don't have the votes. You don't have the votes. Um, when the American public elected the Senate with the composition it has, it was basically, if not inevitable, almost inevitable, we were going to have cuts to Medicaid and the ACA. Um, and um, it, and I just say that because the real answer is to build public support for some sort of workable universal health coverage. And the public did not vote for that, whether they knew it or not. And so they're getting what was, if you were paying attention, clearly going to happen. And I'm sorry about that. And I've done everything I can to fight it. But the notion that the Democrats had cards to play after uh, the House went on break and the president didn't get involved, I just don't see it from a practical standpoint. The Democrats were checkmated, and so they just realized that. And I know it makes people unhappy. It makes me unhappy. But the votes weren't there, and they weren't going to change.
Well,
Marjorie, you have your hand up.
Yes.
Marjorie.
Okay. Um, how much confusion is there in people's minds between Obamacare and the ACA?
A lot. Um, Obamacare and the ACA are the same thing.
Mhm.
Um, I never call it Obamacare because we live in a country where labels seem to determine thought. I mean, the program is no better or worse whether we call it Obamacare, Trump care, or who cares, okay? But that seems to impact people. When I talk about ACA cuts, though, I'm talking about the exchange. But the Affordable Care Act, the two components are the Medicaid expansion, which got cut, and the Affordable Care Act private insurance exchanges. Um, but one of the problems we have is you label something, and that seems to affect the support for it a lot. And it has to do, I don't understand this either. People will say, well, so and so supports it, therefore I'm against it. That is not a good argument. Be for it or against it based on its merits, not on who supports it. Known in philosophy as an ad hominem illogical fallacy.
well, I think we can agree that Fred has done a great job of
Well,
presenting a
thank
lot
you.
of information. Mostly, I appreciate his ability to kind of give an overview of how this is all going to, affect people. I'm fearful that we have an administration that does not mind inflicting pain, uh, and but maybe that'll come to some benefit as more people realize that we need change. I belong to Physicians for a National Health Program, and that's I often misstate it and say plan, but it's actually program. And of course, that's their big concern is we don't have a program. But the opposition just says do away with everything, but then does not have an alternative, which Fred has said stated. So I think we need to be constantly thinking about how we can educate our voters. The League of Women Voters, I have to editorialize and say, it has stated, belief in the need for universal health care, and they've even endorsed single payer is the most likely, single payer is alternatively called Medicare for all, as the most likely way to get there. But unfortunately, it has fallen pretty far down the priority list with all the threats to elections and related factors. So I'm glad that everybody's keeping this on their radar screen. And again, I'm sure extend everybody's great thanks to Fred for this excellent presentation.
Well, thank you for having me, and keep the faith.
Keep trying.
Thank you, Fred.
Thank y'all. Appreciate it very much. Thank you very much.
Thank you so much. Yes, thank you.
Thanks everybody for coming.
Good day, everyone.